and I don't feel like this. Well, yeah, a lot of us do have hormone problems because of all of the things that mess them up. Again, the chemicals in the environment and our out of whack kind of stress response system really does cause a lot of problems for people. I'm not afraid to replace hormones where it needs to be done because we're trying to overcome abnormal stressors from outside of us that the body cannot always compensate for. And if we neglect to do that, then we throw in the towel on a big part of our health. It's not the only thing we need to do, but it's a piece of it. And like I was talking about, the report from World Health Organization that's contributing a lot of the rise in male factor infertility and PCOS and other fertility issues. Same thing connected back to our hormones. We lose a lot of our testosterone production very prematurely, and does this for us. Who wants to lose out on that, at 30 and 40 or even sooner if you are very, very stressed out all the time and don't have good detox systems. Perimenopausally, women plummet with their estrogen. An average age of menopause is 53 to 54. Well, that may have been fine when we used to die at 58, right? How old are you right now? Are you serious? You look great. So, we want to keep feeling good, right? We're not ready to throw in the towel and just feel like we totally crumpled up for the next 40 years, 50 years, and I don't want to feel that way. I haven't been through menopause yet, but I'm pretty sure I'm going to be replacing, I'm 100% sure I'll be replacing my hormones because it appears to be miserable and very frustrating, and that's part of what we do. There are really health protective ways to do hormone replacements. We don't have to constantly freak out if I take that I'm going to give myself breast cancer. There's a lot of other way more compelling things that give us breast cancer than appropriate hormone replacement. It's not for everybody, but it is something I talk about with everybody and make sure we pay attention to it. And it's not just those hormones, it's also, again, our stress hormones, our insulin hormone, our thyroid hormone. All of those are very, very important, and you need to know exactly what's going on in your body. And lastly, people come to us, and me as an obstetrician too, because they have recognized the plight of American kids, and they know that they need to be proactive and do something different, and they know that the time of pregnancy and in the womb and early childhood is the most important sort of developmental, impactful, changing the genetic expression time of life, and want to get healthier and want to create a different in utero place and healthy body for that early development, which is extremely important. These are a couple of cute little babies who we gave these little cute onesies to because their mom said exactly that, and I was really proud of them for changing their health ahead of time because they knew the kind of lasting impact that they could have. And honestly, that's a harder thing for me to get across to people because young moms, even if their bodies aren't really that healthy, they're not really feeling that bad. They're not putting two and two together that, oh, if I don't change this now, it's going to impact my kid with something they notice 15 or 20 years later. That's a big leap to take, right? It's not like, I feel terrible now, please help me, oh God, like pull the tacks out of my feet. And even for myself, I didn't know all of this stuff when I was pregnant with my first biologic child. I was the end of my third year of residency at Northwestern, and we had to rotate through they have a wellness center there that's really great, and I was working with one of the doctors there, and I was drinking Diet Coke. She was looking at me, and I was like, I'm not supposed to be drinking in this room. And she's like, I think I was like 30 or 32 weeks pregnant at the time. She's like, you shouldn't be drinking when you're pregnant. And I was like, oh, it's just a little bit of caffeine. She's like, it's not about the caffeine. And she gave me into some articles that talked about how a lot of those chemicals in soda and sweeteners concentrate in the amniotic fluid and affect nerve cells in the baby. And I was like, oh, why did my obstetrician tell me this? I have spent, I don't know, $30,000 trying to have this kid, and probably 4 or 5 miscarriages at that point. But I didn't know any better. A lot of people don't know any better, and I haven't drank Diet Coke since then, except for maybe if it was mixed with vodka at a party. It doesn't count. But we don't know that. It's not something that we learn from ACOG or whoever. We learn about the Zika virus. We don't learn about all these other important things that are really crucial too. So it's a big relief for people to take, and it's one of my biggest challenges of how to get that across to people soon enough to make a difference. But I work on it a lot. It's a big passion of mine. So for all of these things, you know, we have to be able to dig deeper under your hood to help you figure out where you've hit your wall. Some of the things that we do functional testing for and look very specifically are micronutrient deficiencies, undetected insulin thyroid abnormalities. We talked about that a lot. Adrenal stress, that whole stress response system, because it so dramatically influences so many other things in our body. The hormones that we talked about, occult toxicity in the body, hidden gastrointestinal inflammation. For most people, I do a functional stool study even if they're not telling me they have irritable bowel symptoms, because we usually find some disruption in the microbiome or some inflammatory thing that's happening that's going to cause them a problem eventually, so we need to fix it now, really, so it doesn't get bad down the road. Understanding your genetic vulnerabilities as well as autoimmune response that's going on in the body. Usually if you go to a rheumatologist and you have high autoimmune markers but you don't have symptoms of the disease yet, they just tell you, well, you don't have symptoms of anything yet, like come back when your joints are really hurting or you can't walk anymore or something like that. It's not the best approach to take, and we can do better than that, we really can. Even looking at your regular, so those are all kind of special functional labs that we do, but even looking at your regular blood work, a lot of people get frustrated, and maybe Chelsea, you have this experience, you feel a certain way, going to all this blood work done, and your doctor says, well, your labs are normal, you know, but where do we get these normal ranges? We take a bunch of maybe borderline-ish, healthy-ish Americans, and unless you're at the top 2.5% or bottom 2.5%, it's considered normal. Well, Letitia and Nicole, are you genetically identical? Are your lab normals exactly the same? Is it independent of how you feel? Right. It's so you got to put all of those pieces of the puzzle together and really try and optimize where we are instead of just using these ambiguous normals to guide what we tell people is okay and what is not. And this applies a lot to hormones, thyroid, inflammatory markers, and things that we look at. So what do we do? How do we get help? Because clearly we're not satisfied, right? We know that something is a little bit messed up with how we do things. We got to start thinking outside the box. We can't just follow the status quo. Obviously, I love the World Health Organization, but we know that they're right, so we need to follow what they say. They tell us 90% of our common diseases today are not treatable by orthodox medical procedures, which includes the pills and surgeries and everything that we like to do. Sometimes that's the perfect answer. The day after Christmas, I flew off my bike. I wasn't even doing anything that awesome, and broke both of my arm bones, and they were like sticking out of my skin. It was disgusting. And I went to the emergency room and called a surgeon. They did. I was crying, I was in pain, bleeding everywhere while I sat there for an hour and just walking around like, is somebody gonna help me, please? I'm bleeding everywhere. And I was really happy that somebody fixed that for me, or I would have been maimed for life. That is a success of our crisis care medical system that we have. Half of people that used to get certain types of pneumonia would die. Using antibiotics is a success to prevent that from happening. But unfortunately, many of the diseases that we use those same types of interventions for are chronic lifestyle problems, or hormonal disruptions that we have, or metabolic problems that we have to really look at all these other things we've been talking about tonight to get to the bottom of it and truly fix it. So that's why we have to start thinking outside the box a little bit. And we have to understand that while it's okay to be customers of any industry that is giving us something good and that we need, we have to know that they're not creating our health. That all of these things that we so commonly prescribe, thyroid medications, lipid medications, heartburn medications, asthma medications, those are the top ones, are not making us healthy. Only we can really create our health. We just have to absolutely learn how to do it, and that does involve going outside the box. If you don't want to roll this way or feel at 30, you know, going back to my worst time of my life, really, when I had everything I wanted and crashed, you feel like this. You can't pee, you can't sleep, you have no sex drive, your GI system is all screwed up. We don't really want to live this way. It's not what we want. So we just have to start thinking in different constructs so that we don't go down that road like most other people around us. So what do we do? Because this is what we help people with quite a bit in the functional medicine approach that we take. We got to order the right test. We got to look at all those things that I just told you about so you can correcting the function of your system at a cellular level, rather than just waiting for diseases to come and try and squash out the symptoms that you have because of it. And the whole body's connected, your gut, your brain health, your immune system, everything's all part of the same body. It's not something independent that you see a rheumatologist and a gynecologist, and you may still need to see those people, but everything's a lot more connected than that. And really provide a lot of mentoring and support and systematic process. Kent, do you like Ken? I'm going to call you Kent for some reason. I'm sorry, like Superman. Isn't that his name? No. Yeah, it's changed how much TV I watch. Do you like sports? Yeah, what's your favorite one? Football. Do those players get on the internet and search around and figure out how to play the game and then go play it and be super successful? Is that how they do it? No. What do they have to help them be awesome? You have coaches, right? You have coaches, you have teams, you have all of these systems that help them be amazing. And it's the same thing with anything that you really want to be excellent and awesome at. It involves teamwork and coaching and passing knowledge from one person to another. It's not something you can, some things you can self-learn. But when you really want to take it to the next level, you do need that kind of support. And that's a big part of what we do here. We help people be able to figure out the missing pieces of where they hit a wall, that they're still feeling like crud and they don't want to anymore, and the conventional system is failing them. And it's all the things we've talked about. Nutrition, food is medicine. How does food change our microbiome and affect our genetic expression? How we move. We didn't talk about that a lot tonight, but it's something that we get to with everybody. A big thing, even with people who are trying to exercise and do the right thing, are sometimes doing it in a way that's worsening their stress hormones and putting them worse off than they would otherwise be. It's detoxification. It's making sure your gut is healthy. It's making sure that your nervous system isn't creating stress hormones that are screwing up other things and learning how to control that, and making sure that your hormones are in the right place. So that's a lot of stuff, right? If you just had to walk out of here and go read about this, you might quit. Who would quit? I would too, and I have, and started over many times in this journey for my own self. But the way we help you not do that is to put it all together and make it simple for people to learn and put things into action in a very systematic way. Because otherwise, if you only do one part of it, if you only get a hormone prescription, if you only go on a diet, if you only take some probiotics, if you only go to yoga or whatever you decide to do, it's going to maybe be a little helpful, but it's not going to fix everything for you. And then you fail, and it's not because you don't care or you're just a lazy jerk. You just get overwhelmed and you can't figure out what to do next or what's really working, or you don't really understand what is under your hood that can missing and no one's detected to be able to explain things to you in a better way. So it's super important. So who feels excited, motivated to know how to do things different and better for your health? Good, right? So when you're thinking about that and how you might take action, think about how you could better your life if you were able to have energy when you wake up in the morning and be excited to get through your day, rather than just trying to drag yourself to the kitchen and drink a pot of coffee to be able to make it to the evening and get to come home and watch TV. How would it be to actually resolve some of the problems that you have? That happens a lot. People resolve health problems. It's amazing. I have one patient who I've been working with for about a year now, and she came in because she actually had autoimmune thyroid, but terribly, she had both Hashimotos and Graves. So Hashimotos are antibodies that normally give you low thyroid. Graves are thyroid antibodies that give you high thyroid. And she was also a marathon runner. She was amazing. She was all over the place with her thyroid function, just totally out of whack. And it came to the point where her endocrinologist had said it's time to do a thyroid ablation. So they give you radioactive stuff that basically just kills. That's what the classic treatment for Graves is. Kills the thyroid tissue so that you'll only be low thyroid and you can just take thyroid replacement. And she was like, just don't want to do that. I feel like that's not the right answer. So we've done a lot of work over the last year, and it took a while for her to come around to all the different elements of being able to focus at a cellular level. Like, I can't just focus on these diseases I think I have to focus on how do I fix things at the cellular level so my body can function better. But I saw her yesterday, and she was like, I'm better. You know, I'm not flying all over the place anymore. I very occasionally have to take half of a medicine called methimazole that controls when the thyroid is high, maybe every other week. She was on 5 times that amount every day when we started, and then would suddenly drop low because her Hashimotos flared. I was so excited. So things actually can resolve. It does take some work and commitment, and takes motivation. We do have to be motivated. It's thinking outside the box. It's doing things that are not status quo medicine. If you walk in the mall and you tell people, I'm going to, restore my health by using food as medicine and, detoxifying my body and healing my gut. Or in California, they would be like, yeah, man, let's go. Here, people are going to be like, I'm going to eat some crawfish. I don't really know what you're talking about. So it does take personal motivation, but you can do that, right? We talked about where we find those things in ourselves. And I know that y'all are here because you want something to be different. You want help to be able to change things, and that's a big part of what we do. We really help people form community, because if you surround yourself with people who are thinking about things in what I would consider the right way instead of the idiotic way, then you have a lot more fuel in your system than just being depleted and drained by people thinking the wrong way and antagonizing you constantly from doing what you know is right. So we spend a lot of time creating community and teaching people all about these pillars that we talked about on a very deep level, because that's how you make sustainable change. We can't just tell you to go do something and expect you to just walk out of here and do it for everyone. No, nobody does that, right? It's not possible. So raise your hand again. Who's ready to promote wellness? Pass different legacy good, but I don't have to talk for another hour, which is great. If only a couple of you raised your hand, I would start over. Because clearly we didn't get where we needed to. Not really. Our minds are pretty aggressive that way. So we want to take action, right? As Americans, we get so wound up, so stressed out, and then we get paralyzed because we don't know what to do, or we can't decide to do something or do the right thing. So we have to be able to actually move and get help on what we know is the right way of thinking and the right way to be able to move forward. So I didn't bring you here tonight just to tell you all about it and dump you. It's because that's what we love to do here in our office. I'm still a regular OBGYN, I guess you would say, although I think since I've learned functional medicine, I do a lot better job in that part of the practice too, because I just have more knowledge where I was lacking before. But we also help people through wellness programs and help people really put all of these pillars of health into action. I set aside a certain amount of appointments from the schedule every few weeks for people who are motivated enough to come and learn, to be able to come in and sit down with me for 30 or 40 minutes, however long it takes, to help you understand where, based on all of these concepts that we've talked about tonight, where you're missing the boat, where something's falling short, where in the conventional system things are not working out for you, and why. I give you a big old stack of paperwork, and since we've got an hour to fill it out, it's good though. It's helpful. You kind of learn a lot of things about yourself and how symptoms fit together, and you're kind of excited that someone has finally asked you about things you were wondering if it really even mattered, and it really does matter. And I sit down with you, and while you're kind of learning, okay, this is what I've been missing, I'm getting a better understanding from you if you're the kind of person that's going to be successful. Because it does take motivation. We only will take maybe 15, at most 20 people to work in this way over a month time frame, because that's what we have time and capacity for. And I want everyone to be successful. So I have to understand from you if you're in the right place for me to be able to accept you into that sort of role. So it's a figuring out appointment. I can't fix harder problems in 30 or 40 minutes. If I could, I would be really, really amazing. But that's not possible. So that's what this is for. And if we are a good fit for each other, if you're like, yes, I am this important, this is where I need to go, I don't want to be on medicine, I don't want to end up crumpled up and depressed and on, feeling terrible, whatever the problem may be, I'm ready to do something different, and I think that you're going to be successful, then we move forward, and I explain how it works and how we do it. In our practice, What I have found after doing this for a while is that it's best to take people down really two simultaneous paths. So on one hand, you're seeing me for your individual appointments. We're doing your workup, helping you kind of work through this testing that gives you these, everybody comes in and like, that makes so much sense. I wish somebody had told me that before, put it together like that before. So we do your workup. I explain to you what's been happening, and I make recommendations for you. Now I know if I only did that, maybe 5 or 8% of people would actually follow through and put into action what they really, really need to do. But simultaneously, we have you work through our functional wellness programs, which involves bringing you together in community. You're coming into class, periodically, learning about all of these things that we talked about tonight on a very deep level, and putting it into place in your life in a very actionable, systemic way. So then when I tell you to do something, about 90 to 95% of you are actually doing it, and then your life changes. And then me being a doctor is really fun instead of really awful and depressing. That's why a lot of people burn out and stop practicing medicine, because we feel like we're not getting anywhere. But this is what I have seen works for people, and it's really, really awesome. What people ask me a lot is my insurance cover this? And yes and no. It covers the things that it always covers. It covers your appointments with me. I'm always an insurance provider. I always bill insurance for visits. And it's going to cover your lab work. And then that's where it stops. And that's where we get into the trap of the same place that your endocrinologist got you to, or the same place that your primary care doctor got you to. It doesn't cover this really necessary functional medicine testing that we need to do to help you figure out on a deeper level what the dysfunction is in your body. I tried billing insurance for those things for about 6 months, and it was a freaking disaster. I don't want to ever do that again. It was terrible. People told me not to. I was like, I can do anything. I'm Superwoman. It didn't work out. So we can't bill insurance for that, and we can't bill them because they don't pay us for spending lots of time with you and teaching you and creating the community environment that helps you actually put all these changes in place in your life that's going to change your health forever. But that's okay. I mean, it is an investment for you, but it really changes things. Who in here has a kid with braces? Anybody? Why? How old? 13. Let's give us one. A daughter. What's her name? Veronica. So when Veronica needed braces, why she needed them?
Because her teeth were crooked and her bite was bad.
Okay. So if you said no, Veronica, I'm really sorry. I know that your dentist or your orthodontist recommended some braces, and I know if we don't get this, you may have chronic jaw pain for the rest of your life, and you may get made fun of because your teeth are really disgusting and crooked. I'm sorry. It's just not worth the money. It's just not worth the investment into you. Would you ever do that?
No.
Absolutely not. No. Because if you do that, she's going to have a permanent fix, and she's going to avoid all kinds of problems down the road, right?
Mm-hmm.
And so it's really a very similar situation, working through a process and learning how to promote health and wellness for the rest of your life, that you prevent a lot of problems down the road that you won't have to deal with, which is awesome and amazing. And I see it happen every day. So I'm extremely committed and motivated to provide the service to people in a way that they can actually work in. Unfortunately, with our health insurance, it's becoming more and more like car insurance. So when does your car insurance come into play?
When I get in an accident.
When it's broken? Yeah. What about your life insurance? When does that come into play? Right. Yeah. So increasingly our health insurance is getting worse and worse and worse. It really is only helping us when we're super sick. Even these wellness visits that it pays for, I always laugh because it pays for people's pap smears, but when they're abnormal, it doesn't pay for the treatments, which is really stupid. So we get into that problem. So it's better to invest in yourself a little bit now, learn how to be well, and not have to pay out that 20%, that 40% of these dramatic things that you're going to need in the future. You better just fix it now and get on the ball and be a little bit more proactive. Another question that people ask me is, can I help everybody? I wish I could. Obviously I can't. I would have to be really super sick if I felt that way. But what it comes down to is that either people are just not prioritizing their health, they don't think their goals in life and purpose are important enough to pay attention to, or they've waited too long and they just let things go so far that it would take years and years and years to reverse that kind of dysfunction. Or people ask me, can you help me if I'm busy? Or they come in and they say, I'm just so busy, like I can't do any whatever. Well, my answer to that is I am right there with you. I have 4 little kids. I over babies all night. I have a pretty demanding job, and this is part of your life. It's not in spite of your life. It's something you do to make your life better and enrich your life and change your life and change your kids' lives and change your grandkids' lives and all of that. So when you engage and you do the things you need to do, then you have a lot more time and your brain's functioning better and you have so much more energy than you ever imagined. And it's not just for superheroes. I'm not a superhero. I always laugh with Brittany. I say I'm the healthy girl in black. She may be the healthy girl in white. But it's a journey that we all go on every day. We're not perfect. It's not just for perfect people. It's for people that decide they're important and they're not going to just stick with the status quo. And, you know, we all mess up. We start out good in the morning. We may end up bad at night when we start over in the morning. Don't just say, oh, well, I suck. I'm going to suck for 2 or 3 months and then try and fix this later. No, that's not what we do. So it's absolutely a normal person thing because we're normal people and we can help you put that stuff into place in your life. So just a couple more short little things. Everybody's kind of hot in here. I'm sorry. This is Charlton. A couple people I wanted to share with you that I really love. His wife drugged him in here. She's one of my friends, and they were about to get married. And I think really she was just afraid he was going to have horrible diabetes and heart disease like the rest of his family. And he came in here kicking and screaming, I'm fine, nothing's wrong with me, whatever. And I'm like, everybody, dude, everybody in your family is dying of heart disease. You have horrible allergies. You're going to CrossFit every day, and you still weigh 311 pounds. Something is not going on. And I thought he was going to be a real pill to deal with. But when he started learning, he was amazing. And he lost so much weight. His allergies all went away. Lo and behold, they weren't from grass and pollen. It was from things he was getting exposed to. The leaky gut, overexciting his immune system. When we fixed all those things, his allergies went away. He's like talking about stuff we do all the time. Never thought he would have been a guy to do that, but it changed his life so much. This is Mallory. She was also one of the early patients I worked with. She came in with PCOS and fertility problems, had seen tons of people that really hadn't helped her to be able to get past that. And it took me a while to convince her, again, kind of like the patient with the Graves and the Hashimotos, that we have to focus on the cellular dysfunction. We can't just focus on this disease that you've been told that you have. And we did. We worked through all these processes that we were talking about tonight. 5 months later, she got pregnant. And a few months ago, she had a baby. And it's really awesome. And she's changed her life forever. And she's changed his life because she brought him into the world in a different way than if she had just done vitro like I did without knowing and gotten pregnant in that way. Not that that's a bad thing, but it's really even a greater gift to be able to get our health in the environment with which we put our kids in better in the first place. So just a couple of last little rules. If you are motivated in the way that we are and you're ready to go on this amazing journey with us, we hold our appointment spots for people who are motivated first month to come here. So we want you to sign up and talk with me if that's what you want for yourself, because we'll open the appointments up to people calling in for their pap smears and whatever else they need on a regular level, because we're so busy. We can't just keep them all over it all the time. Number 2, make sure that you fill your paperwork out completely. It's going to take you about an hour, so don't wait until you're like trying to rush around in the morning doing it, or when you get here, because you won't finish, and then I won't have as much information with which to help you understand what's going on with your body when we're consulting together. Make sure you come on time, unless I'm going to have a baby, be delivering a baby, not have a baby. I'm done. I'm done with that. I'm finished. 4 is enough. People always ask me, don't you want a girl? And I'm like, oh my God, you clearly have not met my 4 children. We absolutely do not want a girl. No, thank you. So make sure that you come on time. And if you are in a relationship or have a spouse, have a significant other, make sure that that person comes with you. And that can be hard to organize, I realize, but I stick to that because it's important for me for a few reasons. For one, when I'm talking with you together, and I know this from a lot of experience, there's a lot of things I learn about you that I wouldn't learn if he or she wasn't there with you, that are very important to me in how we move forward. Also, you're making some really life-changing decisions. You're making an investment decision into yourself. You're making lifestyle change decisions, things that are gonna impact your life. So unless you're about to kick that person to the curb and you're, you know, on the backside looking on your online dating places to find a new mate, then that person should come with you, and that's really important. When you take your appointment time out, think about that. If you have to change it later, we'll make some adjustments for you, but try and figure out the best thing that you need. So, we have, Linda here and Brittany. Is Carol here too?
She is.
Okay, and Carol, I know there's a bunch of people, and I'm sorry it's a little warm. So drink some more kombucha, eat some more snacks. We'll be done with this in about 15 minutes. It's not gonna take, long at all, and I'll be around if anybody has any other questions that they wanna ask. All right. Y'all have a good night. So much, ma'am. Two clipboards. If you haven't, just go back to the time, and then I just need you to fill out this. And give this back to me before you leave. And then this is paperwork.
And then you'll come back and we'll basically.
Get to fill this out. Fill this, these papers need to be filled out and given back to us before you leave. Those are right there.
No, I was gonna give it to her. Thank you. Oh, this is, it's in here?
Yeah, the paperwork's in there. You can leave that down. Yeah. Okay. Fill this out.
Can I give you that, honey?
Real people colors on them?
Yeah, do you, like, it's in our bag. Okay.
And here, you can take a clipboard. So that way, this is some appointments. You just need to fill this out for me.
How does the appointment last?
It's about 30 minutes, 45 minutes.
And would it, so you fill out this information and you leave it here and then.
No, you fill out, there's some paperwork in here, you take home, you fill it out, and you bring, yeah, you bring the paperwork back with you. Oh,
And then what's the appointment have to tell you, like, how much the investment is and all
You need
that
one?
stuff?
Oh, yeah, depending on what you need.
You need one?
Yes.
There you go.
Thank you.
Tell me how much
And you?
Yes, ma'am.
spending.
Is that it?
Front and back?
Oh,
Yeah, in the bottom, the information. Or
You have a
your
pen?
insurance
yes, I do.
Okay.
Thank you.
Yeah.
when is your next, seminar?
Well,
Can I put my daughter's name?
Thank you.
Time-wise, can I just write one time?
October 12th.
Does that one take it?
These are the appointment times. This is you? Oh, yeah, no. So it's, these are the days of appointments, yeah. There's another clipboard. There's another clipboard too, right here.
Then we have We do this appointment on Mondays and Wednesdays. We have Wednesday, we have on the 10th.
Yeah, you can call.
Just give us a call.
Just call you.
Yes,
Yes.
yes.
There'll be 2 different appointments, but yes.
Thanks for coming. Thanks for coming and have a good evening. We look forward to seeing you again.
His information. I mean, yeah.
I mean, he can come with me, but I really like, he has things I really like for him to see on first.
Yeah, or y'all can both. Y'all can both.
Or can it just be it together?
Yeah, absolutely. You'll just need 2 sets of
Keep the green.
2 sets of paperwork. Yeah.
Form that you
Should I
need.
put his name on here with it?
Can I get that now and fill it out?
And then if there's an extra, here's yours. So this is the extra paperwork. It's right there. And then fill out, you can just put your information. No, I did not. Actually, he'll need his information too. You have to put his information.
Okay, so I have to make sure.
Yeah.
I'm on this.
Yes. He needs, what time to put it for?
I put it on.
Because usually,
I think on the ninth.
No, but
3, October 10th.
can I do all this for like
October 10th, 2:30.
She's talking to you.
Are you talking to me or her?
oh, no, I'm sorry.
Okay.
I'm sorry.
That's okay, I was like, I just didn't want to walk away.
So then we'll put her, so we'll put y'all for 2 and 2:30.
Yes. Emails me, and then yes,
So I'll put him down on this one.
Can I have a paperwork?
I don't know if I did this. Should I put wife instead of husband? Relationship to subscriber is wife, right?
You must respond or it gets nasty. Thanks for coming.
okay, I think I'm good.
Well, paperwork.
Oh, yeah, absolutely. Here you go. Did you get one of these?
Actually, it took me
No? Okay, so you have to fill this out and put it in. Before you,
I need to put an appointment down. I need-
okay, yeah.
Oh, that's
Okay, do you need all that, or can I give it to you whenever I come?
You don't have your card with you?
Yeah, I don't have like a.
I know she just, it's all the information is done before, or the day that you come. So if you don't have it, then you can just bring it the day of, that's fine.
Here, let's see.
My husband's never issued you.
We can get it the day of, no worries.
It's okay, let me give it to you. It was just digging it out of here.
And so if I have to bring it with me, I can just bring him.
Here we go, look, here you go.
Oh, perfect.
Okay, so I just give this to you?
Let me get this one.
I know one thing, she's a smart lady.
Um,
This is an awesome thing.
11-ish is lunch break, so.
I'm familiar with all this. I went to Karen Dan.
Oh, did you?
Yeah.
Okay. Perfect.
Yep, it's a Monday.
But she went at MVP, you
Yep, I
know.
think I can do that. At 11 o'clock.
You know.
Okay, I didn't do it
Oh,
yet.
you haven't done it yet, okay.
I don't know, I would want my husband to come.
Remember, as long as you
When?
respond, it stops. If you don't respond.
Let's see, what is the
Okay, so don't
5th, honey?
respond. So
What
just
is
keep
the
reminding me.
5th?
Wednesday, October 5th.
It's Wednesday,
And what's the,
Um,
how, it's 30 minutes?
Yeah.
Okay.
Oh, yeah.
probably be.
Make sure you bring some people in
This
filled
is-
out.
Yes,
Because
that's
there's a special.
You need a date? Okay.
I love it. Thanks.
Just Shay will thank you.
No, that's okay.
Our front desk person, these are all her pens.
You gave him my card back, honey?
I did.
Alright.
No, they haven't. Yeah.
Okay, can I write this down?
Good when everybody's gone ahead.
Oh, yeah, I do.
Stand strong
You
together.
already wrote your name?
I did.
Okay,
I put my husband in my,
What is what's your date?
is that the 24th?